Let me introduce my guests who are here with me this morning from San Juan Regional Medical Center, as I mentioned. From the Public Relations Department, Laura Werbner is here. Good morning, and thank you for coming in.
Hello and good morning.
Good to have you here.
Always nice to be
Also
here.
from the operating room manager is with us this morning, Starla Barela. Good morning to you.
Good morning.
Thank you for coming in.
Thank you.
Appreciate you being here. We've talked that you've already been up for hours and hours and hours in meetings, and now you're here.
A few hours.
Yeah, just a few, but thank you both for being here. Laura, let me start with you about some of the things going on at the hospital. Of course, the weather is getting colder, and so with that, we talk about flu, and the hospital has always been providing flu shot clinics for residents, and this year's no different.
Yep, flu season is here. So it's October, and that is when we have our drive-through flu shot clinics. We are offering 2 flu shot clinics this year. They couldn't be any simpler because you don't even have to get out of your car.
I love it.
Yeah.
Right. Just roll up your sleeve.
Yeah. So they are, yes, as you see there, Saturday, the 22nd and the 29th from 9 to noon. You basically just pull in on Maple and you go through the parking lot. We've got a parking lot that's directly behind the hospital where the nurse will just have you be ready, wear short sleeves so you can roll up your sleeve easy, and you sign your consent form, get your shot, and go on your way. It's free. This clinic is for adults 18 and older, so we don't have flu shots to accommodate children at this clinic, but anybody 18 and older, we're happy to serve.
Okay. And I guess it's kind of while supplies last, is how they say it, right? So
yes.
You've got...
We have a lot of supplies, though.
Good.
So,
okay.
And I would say we always have quite a line, a little backup. First thing, people getting in line waiting right for that 9 a.m. to start. But you really don't need to do that. We have hundreds of flu shots. And
so you're not going to run out. You don't think you're going to run out?
I will knock on wood, but
okay.
I really don't think we'll run out. If you don't want to get there, right at 9, skip the line, just go drive right through by coming a little later in the morning, and that should be totally fine.
Okay.
But we are partnering this year with the Public Health Office because we want to encourage people to also get their COVID vaccines. So the Public Health Office is going to be open offering the COVID boosters and COVID vaccines for all ages 6 months and up, same days, same times, and we're really not located too far from each other, so you can go your flu shot and then head over to South Miller and get a COVID booster or shot if you need one. And we're talking about this already this morning. Can you get both at the same time?
Right, and I did.
Yeah,
so you can. So there you go. That's right. And so then you're all set to go. And this is the new booster, we should mention, is kind of been designed for the latest variant of
Omicron booster,
COVID,
yes.
and so it's to be a little bit more effective, I think, in trying to lessen the effects of that part of COVID. So
yeah, we want to keep people healthy. We want to keep people out of the hospital. Of course, people don't want to end up in the hospital with the flu or COVID.
Right.
So we really encourage people to be proactive, get those vaccines, and do their best to stay healthy this winter.
There you go. And as we always say, if folks have a question about a particular vaccine, the best person to ask about that, who knows their personal health conditions and other issues that they may be dealing with, is their personal physician or their primary care person, and that's the person to ask, and then they'll know whether or not that's right for them.
Exactly. Talk to your doctor and come see us if you can.
There you go. So the dates again, October 22nd and October 29th, 9 a.m. to noon, right there at the hospital on Maple, and follow the signs, and I bet you can't miss it.
Corner of Maple and Schwartz. There's a parking lot right there. You won't miss it. We've got signs. We've got people. There'll be cars. There's a tent. A great group of nurses and nursing students as well from the college who come and give those vaccines out for us.
Very good. So there you go. But you have 2 opportunities to do that.
Yes.
And these are for adults only. And
18 and up. And our pediatrics clinic is giving out flu shots for kids. So if you want a flu shot for your child, of course, contact your child's provider, or if they're at San Juan Health Partners Pediatrics, they can go there for that.
There you go. And we haven't really had too bad of a flu season because I think of our masking and our other things with COVID, of course. And so I think folks are just kind of cautiously optimistic that hopefully we won't have a bad flu season. But
we hope so.
If you get a flu shot, then you're more protected.
Exactly. We did talk about that, so I did check on that, and we have not had any patients as of yesterday. When I checked, in the hospital with the flu yet this
Okay.
season. So
Good.
let's keep it that way.
Hopefully we can keep it that way. That's true. Very, very good. Well, excellent. Well, let me ask you too about another thing, and that is the masking policy, because
Yes.
we've talked about COVID and things like that. Things are kind of relaxing a little bit around the state and around the country, but the hospital is still having some masking policies in place.
So yes, it's a little different depending on where you go. But if you come to the main hospital, that lovely building you see right there, if you're watching our visual program,
Right.
then yes, we do still require everybody to wear masks in the hospital. We just have to be safe and protect our patients, protect those really vulnerable people who maybe are immunocompromised. So right now, that is still the policy in the hospital, where please wear a mask. However, we have relaxed that masking policy in our clinics. So if you were to go to the heart center or the spine center, or maybe see your internal medicine doctor or one of the family medicine clinics, you do not have to wear a mask any longer at those places. Of course, if you want to wear a mask, you are always welcome to wear a mask. Whatever is making you feel most comfortable, but you're not required to wear a mask in those clinics.
Got you. But the main hospital, yes.
Yes, the main hospital, yes. Please just keep that mask in the car, because there are some places that you're still going to need it.
Right. And I've noticed that too, even around the community as well, that sometimes you need one. I'm like, oh, okay.
Oh yeah,
I've got one in the car.
Keep one there handy.
There
You never
you
know.
are. So
Yeah.
very good. Good to know. All right. Very, very good. Let's talk about some other stuff this morning. And that's why Starla Barela is here, because the hospital is the owner of a pretty new, I think, because you're just doing training on it already, a new surgical robot in the operating room. And the whole term just sounds fascinating to me. And so I'm glad that you are here to kind of explain to us what a surgical robot is and what it can do. And I imagine it opens up a whole new world of opportunities for your surgeons and the other folks that use the operating room. So tell us a little bit about this piece of equipment. I'm sure it wasn't cheap either.
Well, all good things have a cost.
Yes, they do. But how exciting.
It is very exciting, and we are very pleased to offer the community this new innovative technology, and it's new for our facility. Robotics has been in place for a few years now, but we always want to test things out before we move forward with something for great patient care. So the robot that we purchased is called the Da Vinci. I think for those who can see on the monitor, has a number of arms. It was brought to our attention by one of our providers that it looks very much like a robot in one of the Star Wars movies.
Right.
So this robot is utilized, it's actually robotic assistance, and it is brought into, it's currently in our OR, and we have been using it. So it is, it helps our surgeons in a little bit different way. They actually begin with the robot, their surgical process begins pretty much as normal. The robot is brought in and kind of docked to the instrumentation that's already inserted on the patient. And the provider returns to a console where he has wonderful imaging. It's a virtual visual delight for them because it's so much clearer. They can see more of a true 3D effect. And therefore...
And so that's how they're looking at, I guess, the patient is through this screen or...
Correct.
Right.
Correct. And they will manipulate the arms of the robot, which are kind of internal. It gives them greater access with we already do minimally invasive surgery, but this brings it down to an even tighter mode. So their technical expertise becomes enhanced.
Interesting.
So, very exciting.
A lot of precision, I suppose, is what the word I would maybe think of.
A great deal of precision.
Of how you describe it, right?
Yes.
And so you're doing training these days, too, for other surgeons on this?
We are currently in process. We've had our general surgeons have been busy doing robotics, and we have a urologist that is also participating with that. And we just had a meeting, as I said this morning, with GYN providers that would like to provide women's services using our robot.
So this robot is pretty, I guess, flexible, if you will, and to be able to do all different types of procedures, it sounds like to me, then with all these different surgeons learning how to use it for what they do.
It does provide a great deal of flexibility. We won't have it for all procedures, so it's not its forte, so to speak.
Sure.
But it is, we can use it in a number of different procedures. That's correct.
Right. And as we can see on the screen, and as you mentioned, it's got these, I guess, maybe 4 arms.
Yes.
That we can see in the picture at least. And able to do, I guess, just a lot of, as you were describing, a lot of precision things and just monitor a lot of things with the patient. And just, I guess, I'm not sure how many hospitals are moving to this, but it doesn't seem like too many just yet, or are we kind of on the cutting edge? No, pardon the expression, cutting edge of this type of technology?
Well, I would say that historically, we've never been obviously in a more modern world of technology. And robotics is becoming more standardized, I think, throughout the nation. Of course, there is a cost associated with that, as previously mentioned. So there's that piece of it for facilities to look at. But moving forward, I would not be surprised to see it grow throughout the nation.
What's been the reaction of the doctors? Are they excited to have this new technology to learn and to advance some of their skills maybe, and to offer maybe a little bit more procedures, or maybe a little bit extra things that they maybe couldn't do before without it?
I think they are very excited, number one.
Mm-hmm.
We have a number of providers that perform different procedures, so this is perhaps advantageous towards some more than others a little bit right now.
Right.
But they are very interested in learning more about this and how it works. Those that have used it, of course, have undergone some extensive additional training, as well as our staff members all have to do the same type of thing.
Right. Laura, let me bring you back in as from a marketing standpoint and maybe just a recruitment standpoint. Could this be used in maybe a recruitment for new doctors, new surgeons to come to the area to say, hey, if you come here, you can get trained and use this, or maybe you already are using this in your current hospital?
I think absolutely, because a lot of these doctors who are coming out of their medical training and their residencies and their fellowships, they're using these. They're doing this. As we heard when we recently got 2 new doctors who came in, Dr. Manis and Dr. Manis,
okay,
a general surgeon and a urologist. They're a married couple.
I was going to say, are they related?
Yeah,
because that would be very odd.
They are.
Weren't, but okay.
And they've been trained on this already. So for them, they're just excited to come to a hospital where the equipment is here and they're able to utilize those skills that they have and be able to use the Da Vinci and the treatment they provide.
Right.
Yeah.
Very exciting. And that's the name of the robot, but it goes by Da Vinci, right?
So far.
Which brings us to another topic this morning, which you're having a contest, right?
Yeah.
To name the robot. And so talk to me a little bit about that, Starla. What is that? You're asking for ideas from the community.
Well, we are.
Okay.
We love to incorporate the community because we are here to serve the community and provide the best service that possible. So we are asking the community, the kids primarily, and Laura can weigh in on this, a Name the Robot contest.
Okay.
And we want them to participate, and there will be the winner will receive a few little goodies, and I think Laura has more information.
Yeah.
Okay.
We're going to make it fun. So, of course, probably a lot of parents, maybe Star Wars fans out there, have some ideas of what they think this robot should be named already.
Right.
And they can, of course, feed those ideas to their children, but we really wanted to open it to our school-age kids in our Four Corners community. So any school-age child is able to participate. We're going to have a form on our website, and it's at sanjuanregional.com/robotics, or I think it's actually /robot,
Okay.
where it's simple form. All they have to do is pretty much put their name, their school, their idea for what they think this robot should be named, and we have a committee that's going to be looking at all of these entries and seeing what they best think the name. What fits this robot? What should it be? What are they going to be calling it? Because I'm
Okay.
sure, it's a new member of the team that needs a name, right?
Right.
Yes, indeed.
Right.
Indeed.
Very cool. And so, so mostly for kids.
Mhm.
But if an adult sent an entry in, you wouldn't reject it, would you? You might consider it.
I don't know.
All right.
Why a kid?
Let's
Okay.
consider the prizes.
Yeah.
Oh, okay. Let's
So
think about that. What do you got?
We did make the prizes kind of a family friendly, kid friendly.
Okay.
So some of the I'll let Starla tell about the hospital cool associated prizes, but the ones that are kind of partnering with our community is we're going to have passes to Fly High. So
Nice.
to take 5 people to Fly High, 5 passes to go to the roller rink, go skating, the movie theaters, go to the movies, get some snacks. Just really trying to celebrate our other local area businesses and
Sure.
and have fun with it. But in addition to that, there is also an associated kind of hospital prize pack that I'll let Starla tell you about.
And so we will be welcoming the winner of that. At some point, we'll plan a special day or time for them to come in and actually see the robot.
Nice.
They'll get a picture, a photo up there for them, and meet some of the folks, some of our wonderful staff that will be working on the robot. And I believe they'll get a little plaque to commemorate
Nice.
that.
Okay.
Yeah.
But that doesn't help it. I still want to make an entry then because I want to win those
Oh,
prizes. see,
Scott,
so-
that's what the questions were for.
That-
Do
that
you have
just
some
sounds
names
really
already?
cool. Well, of
picked out,
course.
Scott?
I mean, who wouldn't want to submit robot face or something, like that? But that's
Exactly.
probably not going to win.
No.
But what a great opportunity! Is there a deadline to get these entries in? I imagine you can't leave this open ended for forever,
No.
right?
Yes. There's a deadline. So you're the first person we're telling about this contest. So
Breaking
you heard
news,
it.
just a
You
minute,
heard
everyone. You heard it here first. Wow. Okay.
But we're opening up the contest through November 7th, and our plan is to announce the winner on November
17th.
17th.
Okay.
Yes.
All right. So not a lot of time to get your entries in. I mean, just a couple of few
Yes,
weeks because
but
here we are,
it's,
middle of October.
Easiest form you could ever fill out.
Right. Of course.
Click submit, and then we'll do the work from there.
Okay. And the website again, you confirmed the right address. Where do we need to go?
SanJuanRegional.com/robot.
Okay. And you'll find it right there.
It's there.
Mom and Dad and everybody else. So submit.
And we'll have flyers. We got
Mhm.
flyers. We're going to send them out to the
Okay.
schools. We're going to let people know.
Okay.
But we wanted to let your viewers know first.
Well, I appreciate that. That's very exciting. It's to name the robot, and so, but it's a very exciting tool, as you were mentioning, Starla, about
Yes.
having this in the operating room, and to again get all your doctors, surgeons trained on it, and things like that. And so, where are you? How many doctors at the moment are you able to use this? Do you have a number?
All of our general surgeons either have been or in process of going through their final training or
Okay.
additional skills labs, and some of those they have been in these rooms previously, so it's not completely new to some of them. Our urologist is already up and running, has been through residency, so those 2 service lines are up and running.
Gotcha.
And we're very, very happy and excited to, like I said, to provide this opportunity for our community.
Right.
It's our goal is, I think Laura said it earlier, to always be better, and we take that very seriously for our patients.
Right. I guess one more tool, if you will, right?
Absolutely.
When it comes to healthcare and options for patients and things along that line, and for doctors too, to be able to offer this type of thing, and that maybe, they could do this procedure with this robot, whereas maybe without it, it would be a little bit more complicated. And so
That's correct.
that's where we are. I wanted to ask you too, and Laura, this probably goes back to you a little bit
Yeah.
about the addition to the cancer center,
Oh, yeah.
which has been a really big deal.
Incredible.
In fact, the whole center had to be shut down for several weeks, as this was it months? Yeah,
Yes,
it was.
we shut down at the end of May, and we're back open now, but we
Okay.
just opened back up in October. So we did just start patients who were undergoing their radiation treatment with this brand new equipment. And
Right, there
yeah,
it is.
there is one of them. That's the CT scanner, the GE CT simulator.
Okay.
So this is brand new, top of the line, and it works in tandem with that linear accelerator that I know that you talked about last month with
Yes.
Troy.
Who's there in the picture?
Yes, who's there in the picture. A lot of really cool equipment that just is going to bring a whole new level of treatment to cancer care here that we previously just couldn't do. We just did not have the technology to be able to treat some of these smallest tumors that we can now treat here at home. So patients, instead of having to send them elsewhere to get their care, they're going to be able to get that care right here, not have to leave the community, because this is, weeks long treatments we're talking about when they're going through a course of radiation. And that right
This
there
picture.
is, the Varian Edge, the linear accelerator that actually delivers the radiation.
And from what I remember about my conversations with Troy, this new equipment can really, again, pinpoint a much smaller target, I guess, if you will, of the treatment. And so you can maybe even treat tumors and other things that are a lot smaller than maybe you could have before, and save a lot of the surrounding tissue from getting any extra stuff that doesn't need, I guess, right?
I believe
you can tell that I'm not a physician.
And neither am I.
Right. But that's kind of the idea. But this can do a lot more with procedures and a lot more with for patients, right, than the old one could, I guess is the idea.
And what Troy said was kind of down to 5 millimeters. They've got these cones that they actually put right on that head that just focuses that beam. And and that whole machine, and there you see, putting one of the cones on right there, that whole machine can rotate all the way around to deliver the treatment to the patient. So, and another thing that I thought was really the coolest part about this is, for a lot of these certain types of cancers and the treatments that they need to undergo for them, it cuts down the time that you undergo the treatment. So,
the number of treatments, right? Yeah.
So some of these that were, they said like 5-6 weeks, it's like a 2-week treatment now. So that is significant for the patient.
No kidding. Very true. And so that's exciting. And so this is now up and running after being installed and having to shut down the cancer center for months, as you reminded us.
Yeah.
And so people are able to resume their treatments or get their treatments here at the cancer center. And of course, as we know, a lot of folks travel from throughout the region for their cancer treatment here just because of the availability of this equipment. And so this new equipment, again, provides some more options for doctors and for patients as well.
Yes, and I believe that the hope is that this equipment can also expand outside the scope of treating cancer, and there are other treatments it can provide. I think maybe Troy talked about that a little bit. MS, Parkinson's, there are some really targeted radiation therapies that we're exploring.
Okay, very exciting. So again, more tools for your physicians, for your doctors, and for patients here in the region, which is what it's all about. So very, very good. Well, excellent. Well, I think we're just about out of time this morning, everybody, but I appreciate you both coming in to talk a little bit about the jobs that you do at San Juan Regional Medical Center and these new really investments in the community. And like we've both been saying, it's these aren't cheap, both of these things. The Da Vinci robot, which will soon have a new name, and the new equipment at the cancer center. I mean, both these things are not cheap, but they're investments, I guess, in the healthcare of the community.
Yes, they're terrific investments for our community.
Very good. Very good.
Absolutely.
Well, thank you both for coming in this morning. Good to have you here.
Thanks for having us.
You
Thank
bet.
you.
Thanks so much. Good to see you.